Welcome all to this special webinar event in collaboration with Metagenics and Fullscript. I'm Amy Regan from Fullscript, and I'm so glad that you've joined us today. A few housekeeping notes. Please place all questions you have in the Q&A box for a chance for them to be answered during the presentation. This webinar is being recorded, and the recording will be sent via email to all attendees and registrants, and there's a copy of the presentation slides in the handouts section. Today, we are joined by functional medicine Dr. Philip Oubre, Metagenics Clinical Affairs Liaison, Dr. Malisa Carullo, and then also Fullscript Medical Director, Dr. Alex Keller. Welcome all.
Thank you, Amy. Well, hi, everyone. Pleasure to be here again with you. Thanks for dialing in today on this Tuesday afternoon or morning, wherever you are. I'm acting as your clinical host to these wonderful guests that we have here today. And if you've been tuning into our webinars lately, you'll know that we're trying to adopt more of a conversational experience that kind of is a cross between a podcast and a webinar. So let this be your voice for if you have questions while we're going through the content. We don't want this to be just a didactic presentation. We want it to be interactive. We want you to jump in with questions. If we can't get to all the questions by the end, then we will follow up with answers after the fact. So drop them in the Q&A section, and we'll do our best to get to as many as possible. This is a really exciting topic. We had a huge number of people sign up for today's presentation. Akkermansia seems to be on everyone's mind, and today we're talking about pasteurized Akkermansia, which is a very special, unique ingredient that these two speakers are experts in and will be sharing a lot of great content on. So let's go over well, this is us, so I think we've already done that intro. The objectives for today are pretty straightforward. We're going to do a quick overview of the microbiome, just do a Cole's notes so that you have the foundation of what to know. We're going to learn about the discovery and the history of Akkermansia and review the research between live and pasteurized Akkermansia so you understand the difference. We're also going to talk about the link between Akkermansia, blood glucose regulation, and weight control, which is a very hot topic right now. So stand by for that. And then also beyond that, talking more about Akkermansia's impact on metabolic health. We want to give you actionable strategies for integrating Akkermansia into your practice. So what we like to say is, how do you apply this knowledge into Monday morning practice? So by the end of this, hopefully you'll have obtained that knowledge. And we'll wrap it up with a quick overview of how to apply what you learn in Fullscript. So without further ado, I'll pass it over to Dr. Carullo, who's going to kick us off with an overview of the microbiome. Dr. Carullo?
Perfect. Thanks, Dr. Keller. Okay, so we're going to start with the microbiome, obviously, because the microbiome is a hot topic. There's more and more research being published around the microbiome and the disease states and conditions that can really have an effect through the gut microbiome. So it's most important, I think, for this slide to just really remember that although we all have a unique and personalized microbiome, it does have the ability to change. So what that means is that, although the microbiome can move in and out of health and disease, we can modulate it with treatment recommendations that are really unique and personalized to that person. So it's not a one size fits all. And as practitioners, I think most of us have mastered this. We do this through the use of different probiotics, maybe diet modifications, or even, really specialized prebiotic fibers that are specific to certain bugs to allow them to grow. Okay, so if we look at, start at 10 o'clock on the slide, that's where homeostasis is. And if you continue to move clockwise, this diagram is really just demonstrating that there's that change from health to disease and then back again. So the microbiome is very much influenced by diet and lifestyle. And over time, these disturbances can lead to the development of disease. So on the bottom of the slide, boxed in, this is a reference demonstrating that the microbiome can be restored. This is through the use of a fecal microbiota transplant. And one of the authors on this paper is Dr. William DeVos. You're probably going to hear a lot about him today, at least in my portion of the talk. because a lot of the information I'm presenting is actually, it's his work. It's the history or the timeline of really like his work with Akkermansia. And he was kind enough to provide much of the information you see on these slides today. So we're very thankful for that.
I like that comment, bugs are better than drugs. That's good.
Yeah.
I've not heard that before.
Yeah, and I think that we're going to see through Dr. DeVos's research why that's true. And especially, let's go back to fecal microbiota transplants. So the reason why restoration is possible with these fecal transplants being effective is because, a healthy microbiome is really going to contain microbes that produce specific proteins and metabolites. Some of these are going to be good, some of them are going to be bad. We can see that on the right-hand side of the screen, the LPS, the short-chain fatty acids. But ultimately, the specific proteins and metabolites, or those structural proteins, are going to act as signals. And they're signals to receptors that are going to help us improve or affect barrier function. On the left of the slide, you see specifically the claudin and occludin. Those are tight junction proteins. And this is important since leaky gut has many negative effects associated with it. And you can see that in the middle of the slide, outlining what happens when leaky gut occurs. Okay, so as research papers, continue to roll in and be published, what we have is really just this abundance of correlations. And really like a lack of evidence supporting causality. And Dr. DeVos is huge on causality data, and it is important. And it's important to demonstrate that the microbiome's role in health and disease, especially beyond what's happening locally in the gut, is really important so that we could, incorporate this into future healthcare, right? We need to be able to support, the research with all the gut axes, gut liver, gut brain, beyond these animal models. And, again, that fecal microbiota transplant is a great example of this. It's really a beneficial targeted therapy. Okay, so I think I'm supposed to pause here. If there's any questions, or should I continue?
Keep going for now.
I'm not seeing many questions, so everybody needs to contribute more. Otherwise, it will be more didactic. Or I'm going to start asking Melissa questions.
No, I think all the juicy stuff is about to come for sure.
Oh, okay.
There's a great question that came in, but I'm saving it for later when it's
okay.
Once we come through that.
So in 2004, the first Akkermansia strain, Mut, was isolated and described by a graduate student of Dr. DeVos's. And, over time, the strain was fully sequenced and associations were studied between Akkermansia and overweight or obese populations in particular. So this is actually a working model for early experiments, outlining the metabolic network in the gut, specifically for obesity. So you can see in green the network of bacteria metabolites. Those would be downregulated with any metabolic dysfunction. In red are the microbes that would be increased, as well as increases in any their particular metabolites. And then in yellow, we have metabolites such as lipopolysaccharide and a reduction in GI lining. These would be among some of the drivers, or changes in metabolic health. So these associations are really just the basis or the theory for the animal models that were incorporated in Dr. DeVos's research. So fast forward, 4 or 5 years, and this is the first animal study to test the theory. So in conjunction with Patrice Canny, which you could see on the slide, a picture of Patrice, and you're going to hear his name frequently as well in the literature, or if you read any of the Akkermansia literature, stay up to date, you'll see his name listed in the authors quite often. So this is a diet-induced obesity model. It was applied to mice. You can see there's 4 arms in the study. The control, there's those fed a high-fat diet, those fed a high-fat diet and given live Akkermansia, and then finally those fed high-fat diet and given completely inactivated Akkermansia. So, it was heated at 120 degrees Celsius for 20 minutes. And the bar graph on the left is going to represent serum LPS levels. Bar graph on the right is fat mass. So the results of the study were essentially that live Akkermansia protected the mice from diet-induced obesity, and it did this by improving their barrier function, whereas the autoclaved Akkermansia did not do this. And, following this research, there were many other labs, no association to Dr. DeVos's groups, that was able to also repeat the study with the same results. There were other groups that were able to contribute to the work in understanding the mechanisms associated with akkermansia, their mechanisms of action, and how they would exhibit the effects. And then among, all these different researchers, we saw many individuals discussing akkermansia and the impact of disease interactions with modifiable variables like the diet and medications. So this is where you see a lot of interesting information coming into play. And Dr. Oubre, I'm not going to steal your thunder, I'm going to talk about this more in detail. But for instance, on the left of the screen, you could see that, akkermansia is increased with fasting, with use of certain medications like metformin, but decreased in obesity or certain disease states like IBD or ADHD. You can see that graph too, and you can just see the progression of how much goes basically straight up with research that's been done in akkermansia since 2005, just a total spike in the amount of interest in the area.
Just to clarify something, does akkermansia raise does metformin increase akkermansia levels?
Yeah, so metformin increases akkermansia because we didn't get to that slide yet, but metformin is very nitrogen rich. The structure of metformin has a lot of nitrogen in it. So it will actually feed the akkermansia since it likes carbon and nitrogen. Yeah.
Okay.
Any other questions? Keep going.
There is one here related to seeing on the GI map, oftentimes akkermansia being out of range, either high or low. Any idea why that might be?
Absolutely. Love that question, but I think let's hold off because Dr. Oubre is going to touch on that.
Yeah.
And then we probably both have some strong opinions. I think the same opinion, actually, but we can both touch on it after.
And I have a specific slide. It's from a GIFX, but specific slide showing high akkermansia or normal akkermansia, but very low butyrate levels. And that's the output of akkermansia. So how can it be low if akkermansia is normal? So we'll get to more detail.
Okay.
For sure.
One quick follow-up on metformin. Is there any contraindication in taking an akkermansia-based product with metformin?
No. Our product, no, it's not.
Okay.
I think we'll touch on that too, because I think it will become more clear in a few slides.
Okay.
Yeah. Mm-hmm. Okay, so this is just a nice review slide of many publications demonstrating akkermansia's mechanisms of action in various disorders. Obviously, there's an abundance, again, in this area of research since 2004. And again, worth noting that these were completed in mouse models.
I was a little nervous if I spelled pasteurized right on the whiteboard behind me, so thank you for that. I got the E before the U. Dr. Pasteur would approve.
Dr. Keller, should I keep going? Good.
There was a question here that I think might be relevant, but it might be coming up as well. Just in terms of raising or lowering akkermansia, do spore-based probiotics raise akkermansia?
So in the research I've read, no, but I think that, can you ask that one again too when it comes to Dr. Oubre? Just because
you're just delaying everything.
I can completely answer it right now. I think it would just make more sense if we talk to it when his slides are up, because there may be, the diagrams might help.
Before you switch, Malisa, I want to make sure everybody knows that pasteurized is the same as killed, is the same as inactivated. Kind of, we're using different lingo, but most of our discussion right now is around pasteurized. And looks like you had something to fire back at me.
So yeah, so earlier I talked, the first model that we looked at was killed akkermansia, so autoclaved. So that's at 120 degrees for those 20 minutes. Yes. Pasteurized, we'll see in the next few slides, is going to be 70 degrees for 30 minutes. So like you said, it's inactivated, but we're going to talk.
Because I was wondering about that too. When you said that high, I was like, gosh, that's sterility level. That's way too hot.
Yeah. And to that point, good point, bring that up again. We're going to see that's why we don't use autoclaving for this process, right?
So, and to clarify again, inactive equals pasteurized, but killed equals just dead. They're just dead.
Autoclave, sterile. Yeah.
Got it.
Let's keep going. There's plenty of questions coming in, but
Okay.
we're going to address a lot of them. So
yeah, because many are probably wondering why pasteurization was considered, especially when we just saw with the autoclaved Akkermansia that metabolic improvements were noted, right? So the live Akkermansia didn't work in those cases. So pasteurization of Akkermansia was trialed. Oh, I think I went too far. Yeah, let's do this. Pasteurization of Akkermansia was trialed by Dr. DeVos and his group, really in an effort to just stabilize the bacteria. If we could stabilize it, we could increase shelf life, and then ultimately the goal was to be able to administer to humans safely the Akkermansia. So again, in the same model of diet-induced obesity we just saw with the autoclaved Akkermansia and live, here we have a new component. We've added pasteurized Akkermansia. So it was heated again, 70 degrees Celsius, 30 minutes. You could see that pasteurized cells improved insulin sensitivity as well, just as live cells did. And it is kind of hard to see, actually. I don't know if it's small. You can see it, but it's in orange. We're looking at the pasteurized group in orange. Okay, so initial thoughts and comments are usually, how is it possible if the bacteria is heated, improvements are still noted? And so, again, there's multiple mechanisms involved in the benefits that are linked to Akkermansia, live, Akkermansia, and pasteurized. But for, our form that we're speaking of today, pasteurized, is the AMUC 1100 in particular that's most important. So the specific signaling capacity of AMUC 1100 is actually increased by the pasteurization process. So it binds to toll-like receptor 2, which you can see on the left hand of the screen, the left-hand box. Binds to toll-like receptor 2, and that is going to obviously just signal downstream immune regulation. So remember, toll-like receptors are immune receptors. So anytime you have a molecule binding there, we're going to upregulate the immune system. So we're going to have downstream systemic effects on the immune system that will improve gut barrier function by decreasing inflammation, in particular lipopolysaccharide. Okay, we're going to keep going. So we can see this also depicted in the middle diagram here. This is kind of a cool test. They use antibody labels, so antibodies against total Akkermansia, and then anti-AMUC 1100 labels. And the AMUC 1100 labels are circled in red. So essentially, the pasteurization process, again, is going to inactivate the bacterium itself, but the cell membrane proteins surrounding the bacterium, the AMUC 1100, are just slightly altered. And that change in the surface of the Akkermansia, it actually allows the AMUC 1100 to move closer to the mucosal cells. And that's where the receptors lie. That's where the toll-like receptor 2 lies. So taking the mouse model again a step further, on the right of the screen, you can see that when AMUC 1100 is, I think that's supposed to be pink. It looks kind of red. So that's the AMUC 1100. When it's added along with the high-fat diet, it offers essentially the same protection that we saw with live and pasteurized Akkermansia with a high-fat diet. So Dr. DeVos followed this path of learning, and he wanted to learn more about AMUC 1100 because he basically saw that it was present in high amounts in the stool. And if we think back to the first couple of slides where we saw, the fecal microbial transplant being used, this concept really makes sense. What we have is a beneficial metabolic product being used here, or a postbiotic, if you will.
That's my favorite term, postbiotic. You said that just for me, right?
Yeah. So when we look at the expression of tight junction proteins, so the occludin and the claudin, in the top left, we see the increase in expression in most models that were given AMUC 1100. So again, I think it's supposed to be pink on this slide. So pink represents the AMUC 1100 alone, not the pasteurized Akkermansia. And in the bottom, we can see that even in human cell models, we have an improvement in permeability. We can see this for colon biopsies, and then we can see that there's an increase in integrity of the barrier function in colon tissue on the left as well. Okay, so before I wrap up, I'm just going to mention a few key takeaways. So again, the first one is Dr. DeVos and his team really discovered Mu-T, which is the strain of Akkermansia, and have dedicated over 2 decades to advancing the knowledge of this bacterium. The second important point is that the pasteurization of the bacteria enhances the beneficial properties of the cell membrane, so that AMU 1100, that's going to signal to the toll-like receptors, and it's going to result in immune and metabolic impact that is downstream, so systemic effects being signaled downstream. And then lastly, you just saw an abundance of causal evidence derived mostly from animal models, but Dr. Oubre is going to show you what happens in humans. And then we'll be able to answer all the questions.
Did y'all want to ask any right now?
Oh, yeah, unless there's any right now.
Dr. Keller?
Ooh, there's quite a few here.
Good. We like questions.
You know what? I'm going to hold off, though, because, again, it seems like you're going to answer some of these, if not all of them. So
Okay.
let's see we get through, and then we can circle back on these questions.
Sure.
Okay. Good. So I'm going to talk about Akkermansia, blood glucose regulation, effective weight control, and other components of this product. And so I'll kind of fly through some of this. Some of the things I'm noticing as Dr. Carullo was going through the evidence was just how long, and it's kind of scary. It's 2024 right now when we're recording, and we're living, this is a study from 2019. Wouldn't it be nice if the science met the road a little quicker than 5 years later? And there's been even more studies published since 2019. So all of this is subject to know even more. But this was a human study. So she showed a lot of mouse studies and things. So this was really where the rubber meets the road. This was a 3-arm study where there was a placebo group, a live Akkermansia group, and then a pasteurized Akkermansia group. And the primary goals, as you can see at the bottom, was really looking at feasibility, safety, tolerance, and how did these two compare, 3 with a placebo, how did it really compare in humans? Because we know humans are not tiny mice, and we surprisingly act quite different to some of the other animals. So when they studied it, they noticed that both Akkermansia did show clinical improvements. The pasteurized form was slightly more effective than the live Akkermansia form. And so it's pretty impressive. If you look at each of the things by adding a simple probiotic, I mean, if you think about where conventional and modern medicine is, throwing drugs and things, and here we added a bug, not even a living bug. This is the first I've seen of an inactivated bug still having a profound effect on the microbiome. So adding a probiotic to improve liver enzyme reduction by 24%, body weight reduction down by 5 pounds, and specifically fat down by 3 pounds, hip circumference 1 inch. This is crazy talk. You added an inactivated probiotic and you're getting body weight and liver enzyme changes. You can see the next one with a pink arrow up is the gut barrier function improved, the LPS levels, which Dr. Carullo said several times. LPS is lipopolysaccharide. And I don't know if everyone's connecting the dots, but lipopolysaccharide is a toxin found inside of bacteria. And I always do that air quotes because I think a lot of people assume that when we talk about toxins, we're thinking about Roundup and gasoline and stuff. Bacteria and fungus, they don't make gasoline and Roundup. They make bacterial toxins. And these bacterial toxins are inflammatory to humans. LPS being one of the most, if not the most well-known bacterial toxin known to man. So if you've got a lot of LPS in your bloodstream, humans don't make LPS. So that means it's coming from bacteria in your bowels that you don't really want. So with adding Akkermansia, simple Akkermansia, you reduce LPS levels by 117% in inactivated form. So that's proving that tight junction, the leaky gut that Dr. Carullo talked about earlier. I always use the fingers. I don't know if that helps people, helps me, but like sealing that leaky gut prevents that LPS from leaking across. It's not saying that the bacteria aren't making LPS anymore. They're probably still there. We didn't kill them. It's just sealing the gut so that we as absorption sponges are not absorbing too much LPS, and then reduces cholesterol, reduces insulin resistance, reduce the insulinemia is just a fancy way of saying how much insulin is in the bloodstream, right? So reduce the insulin levels by 34%. This is crazy talk. I mean, instead of adding insulin to these diabetics, we should be giving more pasteurized Akkermansia to reduce their levels so that they have less demand on insulin and more effectiveness of insulin. Now I'm rambling, so I'm going to keep going. But so this is the summary. Oh, you had a question?
Just going to jump in with a question to confirm. We're referring to it as probiotic, we're referring to it as postbiotic, and we're referring to it as inactivated probiotic. You want to clarify what exactly will we call this?
So I don't think anyone's really, and I'm sure Dr. Carullo wants to answer also, I don't think anyone really knows quite what to call it. And another slide is going to diagram this a little better. But the idea is this is an inactivated probiotic that is not living. It was a probiotic at one time. It's not living, but it's causing a downstream set of effects that's creating a postbiotic. And I always like to remind people pre, pro, and post. That just makes sense. A prebiotic is before the bacteria. That's the fiber. So you eat fiber, the prebiotic, that goes to the probiotic in your bowels, which ferment it. That's the living, growing bacteria, right? And then after the bacteria ferment it, they release a postbiotic after the bacteria after. And so butyrate, acetate, propionate, those are postbiotics, also called short-chain fatty acids. So that's what they're producing. So as Akkermansia, even the pasteurized version, is causing a downstream effect to release more mucus in the intestinal lining. And I like to think of it as if you're on a camping trip in Alaska and you put a lot of salmon on the ground, a bear is probably going to show up. You didn't create a bear, but you created the environment for the bear to show up. Bad situation. Maybe that's a bad metaphor, and this is a good situation. You put inactivated Akkermansia there, mucus shows up. If mucus shows up, more Akkermansia shows up and starts actually doing what they're supposed to. It sounds weird, but we release mucus. The Akkermansia eats the mucus and makes a postbiotic from our mucus. That's gross, right? How would that be your job? You live on human snot. Like, oh, I live on human snot. That's my job. So it eats human snot from our intestines and makes postbiotics. As the postbiotics get made, it feeds the intestinal lining, and then that causes more mucus production, which causes more Akkermansia living, growing production. So that's where all of this research is kind of where the research meets the theory is the idea. Did that answer it?
Yeah, so it would be accurate to say that a pasteurized version of Akkermansia can actually act as a probiotic by increasing the presence of Akkermansia. So it's not a direct probiotic in terms of live Akkermansia to the gut, but it's creating the environment for the increased native production of Akkermansia. Would that be accurate?
I can say yes. I think Dr. Carullo is
I'm
going
going
to
to
say
say no. I'm going to say no. If we, by definition, by like the International Probiotic Society, I got their name wrong, but this would be a postbiotic because a probiotic would have to be living. So because this is inactivated or pasteurized, all of the things Dr. Oubre said, it would, by definition, be a postbiotic. But Dr. Oubre will go through ingredients that, if we assume that people have some live Akkermansia present, we should be indirectly able to, by the other mechanisms, increase Akkermansia. But the pasteurized Ak itself is a postbiotic.
Oh, we call it ACK now, not Akkermansia.
Yeah,
cool kids call it ACK. Got it.
I love it. I think it's a great conversation because there's often misunderstanding and misconception about pre, pro, and post, right? So
and it's confusing, right? Yeah. Like we just by accident we'll call it like a pro when it's a post, and yeah. Anyway, I'll let you.
I'd like to clarify one more myth that exists out there because I don't think a lot of people know this, and that is that probiotics take seed in our gut. As far as I know to date, there's no research showing that if I swallow lactobacillus, that I grow lactobacillus. As far as I know and everything I've learned, it's that the probiotics we take cause a downstream effect of regulating inflammation and sealing leaky gut and changing the environment. If you change the environment, then lactobacillus shows up, right? You put enough salmon on the ground in Alaska, a bear is going to show up. So by ripening the environment, you start growing your own microbiome. And I think that's a common misconception that it doesn't matter if you're taking lactobacillus or whatnot, it's not necessarily going to grow. Your focus is changing the environment. You ripen the environment, and then the fruits of your labor will grow in addition. So Akkermansia is really no different other than it's just dead when you swallow it instead of dead when it comes out of you.
Good distinction. Yeah.
Okay, I'm done rambling. So this slide is the summary of the same thing that I just went over, just talking about how safety and efficacy was shown, that it was safe. You can't really overdose on a dead probiotic. You can't get an overgrowth from a dead organism. So it was very safe. It did show that it had the benefits that we were looking for as far as decreasing all kinds of downstream things. You can see cholesterol, triglycerides. And what was very interesting out of this study, and I don't think anyone really anticipated it, was that the pasteurized cell were a little better than the living growing cells. Notice I keep saying a little better. It was not necessarily blown out of the water. They were both competitive, but the living did outperform it. And of course, that it was safety in humans. Okay, so some of the other ingredients that go along with this product to upregulate what we're trying to do and what this discussion is. So I won't discuss this in grave detail, but it's all written there. As Dr. Carullo already said, that AMOC 1100, which is little red dots on the tip of the fimbriae, the pili out there, that's the protein that's causing the downstream effects because the bacteria is dead. That's activating a TLR2. And if anyone knows anything about LDN and how LDN decreases inflammation, it's through, as far as we know, through toll-like receptors and how the immune system communicates through these toll-like receptors. So when Akkermansia modulates those toll-like receptors, it reduces inflammation. Well, if you reduce inflammation in the bowels, then guess what? The gut works better. If the gut works better, then it seals its own leaky gut. And then if the gut is healed, of course, anything can be healed. Insulin gets better, blood sugar gets better, health is better. So same thing, it increases the expression of the tight junction proteins. If you seal that gut, you reduce inflammation, everything gets better. By sealing the gut, you reduce LPS levels. As everyone remembers, is that metabolic endotoxin inside of the bacteria that's being released and making us sick, but it's being sealed out by the tight junctions. And of course, by decreasing those things, you reduce body weight, you reduce fat mass gain, improve glucose tolerance. So all of that is from the pasteurized Akkermansia. And I guess there it is, postbiotic, labeled at the top. So I can't call it a dead probiotic. I'm corrected. This is a diagram that Dr. Carullo made after I asked her to, a fabulous diagram. Thank you, Dr. Carullo. And so it kind of summarizes everything that we're going for in this product to regenerate Akkermansia. And although we may not be able to say that for sure it regenerates Akkermansia, in my line of work, we're doing repeat stool studies and we're seeing regeneration. So I know it works, whether I can say it in the science formal or not. But there's the different components that I'll kind of walk through. The AMOC 1100, I guess y'all can't see my cursor, but the AMOC 1100 circled in that yellow diagram is interacting with that toll-like receptor, which is causing a decrease in LPS, decreasing in inflammation down at the bloodstream level. That line of cells is colonocytes, that tiny little microvilli single cell layer that's interacting with your microbiome. And if you think about it, these guys are like waving out there in the fray trying to absorb nutrients, and they've got a battle in their hands. They're trying to fight fungus and bacteria and other organisms that are trying to eat them, and they're trying to eat the food and a battle for nutrients. So they've constantly got this battle, especially when you're eating cheeseburgers and French fries, and there's all this inflammation. So that AMOC 1100 is reducing the inflammation so that it can seal the leaky gut. If you look a little left to the diagram, you'll see that goblet cell in yellow. And that goblet cell is what's producing the mucus that live Akkermansia is eating when it's present in your mucus layer. And then even further to the left, I don't know why we did right to left, but the cell all the way on the left side is a neuroendocrine cell. It's kind of crazy. I heard Dr. Bland talk about the gut as a neuroendocrine immuno. He listed like 5 adjectives when he listed the gut. And I'm like, yeah, I can't say that 10 times, but he's absolutely right. So the gut is an endocrine hormone or endocrine gland, and it's releasing GLP-1, which everybody knows what a GLP-1 is now with the Ozempics and semaglutide. And if you increase GLP-1, you improve insulin sensitivity, you decrease satiety and increase satiety, which means you eat less, right? And then you lose weight. But if you notice in that top left, the purple diagram, that's where the magic is. If you can increase butyrate, acetate, propionic, those are postbiotics. So in this diagram, goblet cell releases mucus, Akkermansia eats the mucus, releases butyrate and acetate, and those feed the colonocyte. You can see purple inside the little cell where it says food for colonocyte. You feed the colonocytes, they manage their own barrier. You manage your own barrier, decrease inflammation. Now you've got to feed forward positive system, a snowball in a good way kind of idea. And then at the very bottom of the diagram showing the fat mass reduction, insulin sensitivity, all that jazz. So that's about the Akkermansia. There's some other ingredients in the product like green tea extract, which I think most people have at least heard of at some point, but EGCG in that diagram, if we went back, the EGCG is interacting with that goblet cell. The EGCG is stimulating the mucus production in the bowels. In addition, EGCG has been well known to increase energy expenditure. It's known in the blood sugar world and the weight loss world. This is a decaffeinated version. Of course, you're drinking enough caffeine, you'll vibrate at a high enough frequency, you might lose some weight, but this is a decaffeinated. So the EGCG by itself has benefits. That's well known. So there's the diagram again, highlighting the EGCG. Chromium is also included. Lots of people know about chromium involved in blood sugar regulation. Well studied, no surprise there. Decreases fasting glucose, decreases insulin, A1C, all those are the same metric. HOMA-IR, not a lot of people know about, but it's just an insulin resistance calculation based on the insulin levels and C-peptide and various factors. I forget what all is included in that. But chromium is just a necessary ingredient in reducing blood sugar. Vitamin D is thrown in the product, and I don't think I need to spend any time on how important vitamin D is, just a critical element. There's not a ton in the product, but it does add a little bit. I do like to spend a little time on vitamin B2, riboflavin, and I really don't think the research has caught up here. But obviously, vitamin B2, B vitamins are useful in everyone. There's obviously a deficiency that happens, a syndrome that happens if you're deficient in a B vitamin. But what's really fascinating in this gut is that it's useful in promoting butyrate production. And in my line of work, I frequently see B2 deficiency in patients that are brand new to practice, coming in as a new patient, and we're testing their B2 levels in organic acid testing. So in either a Nutraval and organic acid test, it'll show riboflavin marker. And we commonly see people that are deficient in the beginning. And as we heal them, their B2 level gets better. So this was included inside the pasteurized Akkermansia product because obviously it's got benefits by itself, but somehow it's regulating gut function further than we even know. So, and I've got a slide to show that in a second, but who's useful for these Akkermansia products? I would say anyone with a pulse, because we all have a gut issue commonly by the time we discover functional medicine. We've been eating Doritos and Pop-Tarts for way too long before we realized we weren't supposed to be eating that way. So anyone with a pulse can use Akkermansia, but specifically, obviously people with cardiometabolic risk factors. That sounds kind of crazy that, hey, here's this person with a heart attack risk and you're going to give them Akkermansia. You're most likely going to be judged by your conventional medicine colleagues, but the research is there. You manage, and in this Ozempic pandemic that's happening is showing that if you reduce someone's body weight, you reduce someone's fat mass, you reduce their heart attack risk. So this is in the same lines. You make someone healthier and their heart attack risk drops. So of course, if their Akkermansia levels are low on a stool study, then that would be a reason to use it. If their gut microbiome metabolites, another way of saying postbiotic, another way of saying short chain fatty acids, if those are low, clearly they need more Akkermansia, more EGCG to stimulate that mucus production. Then, of course, anybody that's got ongoing stressors, medications, antibiotics, lifestyle factors, and they've proven that stress increases yeast levels, and yeast levels diminish everything in our bodies and stress our gut barrier function. So any kind of lifestyle issue, even divorce, anything that's outside has an impact on our gut. So using your supplements to help battle some of that.
I gotta jump in. We're at over 50 questions, so we got to answer some of them now.
Okay, well, here's the last two slides to show. This is what a B2 deficiency looks like. It's one of those weird markers where the level is high, saying you have a high need for it. You're deficient. That's an organic acid test. And then this is the example of someone asked earlier. Here's one of my real life patients with a very healthy Akkermansia level, not too high, definitely not low, but a high Akkermansia level. And you can see that there in red. But then when you look at their short chain fatty acids, which are also called their postbiotics, their butyrate concentration is very low. It's absent. So maybe they have dead Akkermansia in their stool. That's what you're looking at. The PCR test that you see on a stool study is dead bacterial DNA in your stool. So obviously there's dead bacteria in your system, but it's obviously not living very well. Either that or you're not feeding them with enough fiber to make anything. So this person needs it. The other reason I like this slide, last thing I promised Dr. Keller, is if you look at the butyrate percentage, do not get fooled by the butyrate percentage. The butyrate percentage is good, but a good percentage of a really crappy number is still a crappy number. So you got to follow the concentration, or you got to do some math on your own. So don't get fooled by that. Okay.
Wow. A lot of information in there and fantastic information. The questions are flying in here. We're going to try to address them, and then we have a little bit more content, and then we'll get into a full-blown Q&A. Anyway, well done on getting through that content so fast.
We want to hear the questions.
Yeah.
I could talk all day. You give me, I'm like air. You put me in a space and I'll fill it.
There's a few questions here regarding Ozempic and GLP-1, and one of the questions is, how do you use pasteurized Akkermansia either in combination with or as a replacement for?
For some reason, I'm getting some microphone interference on your end. So I think I heard the question, like, how can Akkermansia and semaglutide or GLP-1 agonists, do they interfere? Can they benefit each other?
Right. Or can you use pasteurized Akkermansia if you want to wean someone off semaglutide?
Well, you're talking about a major bazooka compared to a little 22 BB gun kind of deal. Like, so the semaglutide Ozempic is just falsely creating or falsely putting GLP-1 into the system, where your own human body isn't necessarily producing more. Now, I do believe more research is going to come out that just like the field of dreams, as you build the field, random ghosts show up to play baseball. So the idea is as you add these GLP-1s and people lose their weight, and they usually, as people lose weight and they feel better, they start taking care of themselves better because they want to maintain that weight. So I do believe, now science is going to back this up, but as a practicing physician, I get to make some claims that maybe Dr. Carullo can't. But I think as you add semaglutide, Ozempic, whatever you want to add, and people lose their weight, their own microbiome will get healthier in the intermedium and will start releasing more GLP-1. So absolutely support their Akkermansia levels, absolutely change their nutrition, get them moving and exercising. This GLP-1 movement is kind of brand new in the grand scheme of things. And right now it's all drug focused, but we know that you can lose weight by changing your nutrition and moving. So of course you can stimulate your GLP-1s naturally. Use any cheat you can to help people get to that healthier place. And once they're at that healthier place, it's easier to maintain that health than regain that health.
Yeah. Okay. And so then you'd likely advocate to combine semaglutide use with Akkermansia, right? So you can do that, use that 22 in the background while you're using the bazooka. And then ideally, if you're improving the terrain, then gradually you could potentially wean off the bazooka.
Exactly. I mean, this is exactly what we do. Every patient that comes in, we do gut healing. I don't care what your problem is. Everything's fixed through gut healing. So every patient is going to get Akkermansia gut healing protocol. And if weight loss is an immediate priority for them right now, then give them the semaglutide, get that weight down so that they feel accomplished. And as they feel accomplished, they can continue accomplishing more. You got to play the psychology into medicine. That's where the art of medicine comes in. It's not just, oh, the right thing to do is heal the gut and change the nutrition, and then you'll lose weight 6 months from now. But that person may not be your patient in 6 months because they gave up. But you get them to get a taste of weight loss right now, and now all of a sudden they're supercharged to change their diet.
Yeah, and that's the beauty of integrative medicine, right? Like this is just another formula to add to the protocol. It's just another tool. It's not the end all be all. We're still going to be doing diet modifications. We're going to be adding prebiotics, right? We know that Akkermansia likes to eat human milk oligosaccharides. So that's a really good prebiotic. Since this is a postbiotic, we may or may not want to stick a probiotic in there. Did I mess that up? This is a postbiotic, so we might want to still use a probiotic too. Because we want to increase the fermenters, right? The lactobacillus, the bifido, and then what their output's going to be of short chain fatty acids. So yeah, definitely, we don't have any research showing what happens when we do this as a protocol, but absolutely, like it's definitely a safe option. Mm-hmm.
Do you have any recommendations for the kinds of probiotics that would be ideal? I know we're going to talk about one in a second, but is there anything else kind of broadly that you would suggest?
I'm a huge fan of Saccharomyces boulardii. I realize that's not technically really a living, growing microbe in the human intestinal tract, but I'm a big fan of SAC-B as being a regulator of the good guys and the bad guys, not fully understood, but well researched. Because this is all this motivation towards Akkermansia is great. Functional medicine included has been too focused on eradication for too long, just like conventional medicine. We want to eradicate Candida. You want to eradicate the LPS organism, so focused on eradication that in my experience, most of the patients that have seen other functional medicine doctors and then land at our practice, their doctor has been too focused on eradication and not focused on support and regeneration. You can't eradicate something and have nothing to take over the eradicated area. So I love all this push towards Akkermansia, regenerate, rebuild, and then try to eradicate the bad guys, and the good guys will help you take over the power, right? So I forget what questions you asked, but I
completely agree. I'll take it from here. I completely agree, because even with SIBO or any of these conditions, if we like take a really good history and we look back, it's like, okay, how did we get here? How did the patient get here? And it's a dysbiosis somewhere, right? There was a diminishing diversity at some point, and that's what we need to replenish for sure. We just got to get that homeostasis, that balance back. So if we're looking for, short chain fatty acid output, we want to do probiotics that are like lactobacillus or bifido in particular. Like there's certain strains that we'd be looking for. I think Dr. Keller, you said that there was a question earlier about soil-based organisms. So those aren't commensal organisms. So those would be useful to make that balance work, because they don't last as like very long in the intestinal tract either. But they have different mechanisms. They could be enzymes, they could be eradication. So they're not going to directly increase Akkermansia, but if they move us or shift us towards homeostasis, that could help, right?
Yeah, kind of like
in my practice.
Yeah,
go ahead.
I was going to say about improving the terrain will then encourage the native microbiome or microbes.
Diversity in the milieu. Yep,
exactly.
for sure.
Exactly.
Yeah, in our practice, we use all of them. We're going to use, and various patients can only swallow and pay for so many pills. So we'll use the living growing probiotics like Dr. Carullo mentioned. We use the SAC-B, we use the spore-based, and we use the Akkermansia, all in trying to regenerate, change that terrain so that when we go to eradication, we have something to take over the power.
Yeah, and I just want to make another point that I'm thinking now based off of what Dr. Oubre said, that some of the results that we're seeing on organic acids could actually just be because that terrain or that milieu is not diverse, right? So if we're seeing high butyrate that's not being used, like, are you just supplementing butyrate? Because we know that acetate and propionate, they need to be in a certain ratio with butyrate to be used. Again, like, it's just diversity in what's happening downstream. I think that Dr. Oubre heard me say this, a few other people have, but I really think, like, as the research evolves, like, we all need to move with the shift. And a lot of this, like, replenishing of probis, I think it's necessary, but for us to manipulate levels of Akkermansia or other bacteria from, like, a stool test is definitely becoming passé. Like, we need to be looking at what metabolites are there and in what levels, and then what we need to, do to increase those. I don't think the testing is at that level yet, but if we think about the fecal microbiota transplant, like, that's essentially what's happening. We're flooding, someone else with metabolites, right? So
It's a nice way to say that.
Yeah, I think that we need to essentially stop manipulating, like we did in the past, like increase, decrease levels of certain bugs, and look at the big picture and what's happening system-wide. Yeah, and I think that answers a lot of questions that came up about just like high, low levels. I think the answer is, like, we got to look past that and think about, again, like Dr. Oubre said, it's not just about replenishing or taking that probi. It's what is that probi doing with the fibers you're feeding it? Like, what is it pooping out? And it's those metabolites, those postbiotics that are what are killer in the body. Like, killer good, killer good.
Mm-hmm. You see how she keeps shortening all the words?
I saw that. Probi.
Sorry, yeah.
So
I'm not a cool kid.
I'm going to ask 2 more questions, and then we'll get through the rest of the slides, and then
Okay.
a lot more questions we can go through. But a couple questions have come in around the time to impact, or the time to benefit. You talked about that human trial where there was numerous benefits of pasteurized Akkermansia. What's the approximate expected duration of use by the time you start seeing those kinds of impacts? Is it 12 weeks? Is it 6 months? Is it longer? What's the expected timeline?
Dr. Carullo, you're more the science nerd. You can take that one.
This study, I take this verbal abuse from you. Yeah, I don't mind it. It was a 3 month. The duration of the study was 3 months long. So I think with anything, though, we would always give, like, at least a 3 to 4 month trial duration, right, for the system, right? Even if we're looking at biomarkers and whatnot. But I think that, we've anecdotally heard of people seeing results quicker, but study was 3 months.
Well, and I piggyback that same thing. You got to remember, in a research article, they're adding one thing, right? You got placebo, live, or inactivated. That's all they did. If they were eating cheeseburgers, they kept eating cheeseburgers, right? But in my clinical practice, when someone comes to see me, they've already filled out their forms. They know what they're in for. They've watched my YouTube videos. They know what they're in for. And they're changing their diet. They've already binged and ate ice cream at McDonald's the day before they came in for our visit, because they knew today is the day they change. So we're seeing people, within 2 weeks, they're already feeling better. They're already seeing the scale shift, because inflammation regulates so much. So if you change your nutrition, you add powerful supplements, and not just Akkermansia, you add powerful supplements that modulate gut function and inflammation levels, vitamin D, all of that stuff, and you're changing nutrition. It's so impactful in just a couple weeks. So if you're just going to give Akkermansia to a 300-pound diabetic and you want to see them a healthy body weight and get off of insulin, you're going to have to wait a year or 2. But that's not what we're all doing, right? We're adding multiple tools. So that's the easy answer. You'll see it immediately, depending on what else they're doing.
I think that's a good distinction. The fact that you can see some short-term benefits, but it has to be done in combination with other types of interventions. But in the long term, if you're consistent about it, because there were some questions here about should we take this or suggest it in the short term or for the long term, ongoing, it seems like this is something that you need to be committed to for the long term, right? And obviously making the dietary and lifestyle changes, but using pasteurized Akkermansia, you're not just going to see long-term benefits by using it for 3 months and then stopping. you have to take it on a consistent basis?
You know, Dr. Keller, I'll say yes and no. So, and in our practice, we're constantly evolving our protocol. We're not a functional medicine shop where when you show up, you get your plan and like, all right, I'll see you in a year after this works, right? No. We're adding some supplements, and then we're going to see you in 2 weeks and in 4 weeks, and we're going to change those supplements. We're going to change that regimen. We're going to keep evolving that regimen because, like I said, we're trying to regenerate the good guys, give more and more power to the good guys, and then we're going to decrease the regeneration, and we're going to add in the eradication stuff. I find most humans are only willing to swallow about 12 to 16 pills. That's kind of my cutoff, about 12 to 16 pills at a time. So yes, it'd be nice if we took Akkermansia forever. If you had the wallet to handle it and you were willing to swallow that many pills, great. But in the realm of functional medicine, the art of medicine, you got to add those things, you got to regenerate them. And then you got to assume that with the patient's nutrition and lifestyle, that they're managing their own Akkermansia. So now when you go on your eradication module, you still have the living growing Akkermansia that you've already regenerated. So yeah, we're kind of telling people at least 1 or 2 months in the beginning before we do that eradication protocol, but then you're going to get on it again after that eradication protocol to regenerate it again, because it's a push and pull, and we got to get to that biofilm. We got to get to those bad guys. It's not just one and done. You can't just do a Candida diet for 2 weeks and say you're done. No. This is a complex system of organisms that you've created with your Doritos and Pop-Tarts, and it's going to take some work to undo.
Yep.
I don't know if anyone else ate Doritos and Pop-Tarts. I mean, that's a big deal. Hi, my name is Dr. Oubre, and I had a Pop-Tart obsession.
Yeah, no, I love it. Okay, well, that's actually a good segue to the last question, and we'll get through these last slides. So there's a couple of questions that fall under this realm of the things we can do to increase native Akkermansia, right? So one question is fasting. How long and how effective is fasting for raising Akkermansia? Another is if metformin is related to increasing nitrogen levels and that contributes to Akkermansia increase, what about increasing protein increase? And then a third question was, why would ADHD lower the level of Akkermansia? Or is that more having to do with there's a correlation between lower Akkermansia and lower ADHD? So I'll stop there because that's kind of 3 in 1.
Yeah, that was not fair, Dr. Keller. Last question was like 4 questions wrapped in one.
There's a lot in here.
So I don't think the ADHD, at least I'm not familiar with the research, but my assumption is so much of brain, as Dr. Carullo pointed out, the gut-brain axis, right? It's the gut-everything axis. So if not only Akkermansia is low, but if Akkermansia is low, that usually means fungus or Candida or some other organism is out of balance. And they've even proven that good guys, so-called good probiotics in the bowels in overgrowth actually turn into bad guys. So it's all about balance, much more than it is you want that one and not that one. The balance is everything. So I'd say, yeah, if a kid's got ADHD or autism or whatever, you restore the gut and so much of the brain activity normalizes itself, not because this Akkermansia product is the latest and greatest. It is the latest and greatest, but our human intestinal tract, our human immune system is so good at figuring it out. You got to like shuffle the deck and your immune system will pick who stays. It's the customs department of the country. You give it enough power and enough tools, it will fix the microbiome for you.
Yeah. Okay. Pause there for 1 second. So what would that be on organic acid? I don't know how to say it. Kynurin.
KY.
Yes. Mm-hmm. So that would typically, be off on the organic acid test, because if you have, hyperpermeability, we're having more inflammation. It's going to shift away from serotonin receptors and then all that downstream stuff with the brain. So, okay, you can continue. I kind of forget the question. So, Dr. Keller,
I did too. I was hoping you'd remind me what the other questions were.
So ADHD was one, fasting and protein intake as it relates to metformin.
I'm a huge proponent of fasting, What I will say, though, is that there's some research showing that fasting and Candida diets, low sugar specific diets, low carb, like keto type diets, actually kicks yeast and fungus into a longevity phase and a hibernation phase. So they're actually harder to eradicate. Yeah, they go to sleep, but they come right back awake when you start eating carbs and things again. So I love fasting, but we typically reserve that for after we're done healing the gut, or at least not doing intensive fast during the healing of the gut. Now that can mean like you can do some intermittent fasting. And that, I think when you say fasting, most people think intermittent, like, oh, 16 hours. Intermittent fasting is not a big deal. And everyone should be pairing intermittent fasting into their life, no matter where they're at in their healing journey. If you can't fast 16 hours, then you've got some biochemistry that needs to be fixed. So don't jump to 16 if your body can't handle it, but everyone should be able to do 16 no matter where they're at. But when you say fasting, I hear 24, 72 hour, 5-day fast, 3 and 5 day fast, which are incredibly powerful. But the human needs to work into that fast. They cannot jump to that. No one should be experimenting with that. Right. I shouldn't say no one. It's a useful tool, but it's a hard tool if you're going to throw it out in the beginning of your journey. So yes, intermittent fasting for pretty much everyone 3 times a week, if not 7 days a week. But I don't want to say I know too much about specifically benefiting Akkermansia.
So I don't know what the duration was in the study for the fasting, but essentially the mechanism is that you're not feeding the Akkermansia like polyphenols or other prebiotics. So they're going to be munching on, like eating the mucus, which is going to stimulate more mucus production, more Akkermansia production. So that's the mechanism with the fasting. So that's why you get an increase in the Akkermansia. But I think it was more of an intermittent fast. And then there was the protein question.
Related to nitrogen.
Right. So
with metformin and increasing nitrogen, which led to an increase in Akkermansia.
So metformin is actually like providing the nitrogen because the structure of metformin is like high in nitrogen. So that would provide. Yeah.
The same. You would assume.
Yeah. So the protein being high is the question. Would it be high? What was the question? If it's high Akkermansia?
Proteins are high in nitrogen and nitrogen contributors. Shouldn't they have a similar mechanism in that sense? And I mean, actually, you can probably tie this together with a
fasting. The same kind of thing. It's like you're not feeding the Akkermansia. You're not getting diversity from prebiotic fibers, essentially. So they're like eating or fasting on what's there, right? So the mucous membrane and then whatever they have there, the nitrogen source. Yeah.
I mean, I'm probably stretching here a little bit, but you could essentially say that by doing intermittent fasting, increasing protein intake, increasing fiber intake, you're essentially doing 3 very beneficial things to increase not just Akkermansia, but general diversity. And Akkermansia will
everything in moderation. Yep, including moderation. That's just it. Yeah.
Well, and like we talked about earlier, if you're eating protein, you're probably not eating Pop-Tarts. So that's just called a healthy diet, right? If you're eating a healthy, well-balanced, macro-balanced nutritional plan, then chances are you're going to benefit Akkermansia. It doesn't need to be that sciencey. So yeah.
Okay. All right, let's get through these last slides because I know we're coming up on time and we try to stay on time with our presentations, even though I would love to stay longer with you and answer all of the questions. But we'll tackle that and I'll announce something here that we're going to do as well as a follow-up. So one thing to highlight is we have not talked about the product. We've referred to the product, and Dr. Oubre went through the ingredients of the mysterious product, but we're deliberately not talking about the product here so that we can talk more about the evidence. And a lot of this has to do with the conflict of interest that comes up between talking about evidence and talking about products side by side. So for practical use here, what we're guiding you in this presentation to do is, if you go to Fullscript and you search pasteurized Akkermansia municiphala, and make sure you type Akkermansia accurately. We discovered that if you don't, then it kind of changes the search results. But anyway, if you type this in or just pasteurized Akkermansia, you'll find the product that we're referring to here. So we're not going to mention what that is, but just do that. You'll find it. The other thing we're going to provide is a protocol for healthy blood sugar support. This is formulated in combination between Metagenics and Fullscript that contains these specific ingredients that are all beneficial for blood sugar regulation. So you can consider this product in combination with other products that contain these ingredients, including a probiotic that contains Bifidobacterium lactis beef 420. That's one example of a probiotic that is beneficial for blood sugar regulation. So that's just one example. There's other examples, but this is one that we've put together here as a protocol. You'll be getting this in your follow-up email. So after the webinar, you'll get a link for this. It'll also be listed on the landing page for this product as well. Then you can also use these QR codes that will take you to that landing page to give you more information about the product. As a follow-up, we're going to invite everyone who registered for this webinar to another webinar that is much more product specific. So there we're going to talk about the product, we're going to talk about how it was created, formulated, and we're going to detach discussing the evidence so that we can be a little bit more liberal, talk more about the structure function. So what we're trying to do here is just keep kind of church and state separate, and which allows us to talk much more about the evidence and the details. So this is some additional research here. I'm going to leave it on this slide if you want to scan this. We have a few minutes left here for a couple additional questions, and then whatever we don't get to, we're going to summarize after the fact, and we'll send those as a follow-up as well. So sorry if we don't get to everything, but we'll cover a few more here, and then we'll let you go. Okay, so let's see what there's a good one
While
here.
you're looking, Dr. Keller, can I make a shameless plug for other practicing physicians, practitioners out there?
Absolutely.
2-fucosylactose, 2FL, is one of the most powerful ingredients I have ever used in my medical practice. One of my patients, I saw him recently, he nicknamed this product MFP, Magical Food Powder. I love to tell the story. He was only sleeping, and when you're hearing someone's story, like taking notes, you're like, yeah, I'm only sleeping 4 to 6 hours per week. And I went, why? I feel terrible with one night of 4 to 6 hours. Well, we started this 2FL product on him, and he came back and called it Magical Food Powder because he started immediately sleeping 4 to 6 hours a night. Now, that still wasn't enough by my standard, but if you're not using 2FL, you don't know what 2FL is, you need to go look it up. You need to be using it. It is one of my secret weapons that I'm kind of scared to let everyone else know of, but there I said it.
Absolutely agree with that. Yeah, a lot of great research coming out about that as well. Yeah. Okay, so there's been a couple questions that have come up around an alternative use for this related to rheumatoid arthritis. So can you answer anything specific to the use of pasteurized Akkermansia and rheumatoid arthritis and or autoimmune management / immune regulation?
Oh, you're talking about like practice. This is what we do. Is our claim to fame is reversing autoimmune diseases, and rheumatoid arthritis being one of the most common. Surprisingly, it's not one of the most common we see, but supposedly out there, it's one of the most common. And so we've seen rheumatoid arthritis reversals. Now, you're not going to add Akkermansia and magically reverse anyone's rheumatoid arthritis, right? It's always multifactorial. It's gut function, and the leaky gut is a big portion of it. So you heal the leaky gut, you immediately decrease inflammation. You decrease inflammation, that rheumatoid arthritis patient is going to feel better almost immediately. Within the first month, your RA patient should be feeling better from the decreased inflammation. But you've got a whole level of things to do. You've got to finish eradicating the bad bugs that are causing the rheumatoid, the molecular mimicry, and then you're almost indefinitely going to have to detox those patients. Typically, this is not a scientific study, but my rheumatoid arthritis patients, they obviously have gut issues, but they seem to be really toxic patients, just chemical toxic patients with man-made chemicals, not so much heavy metals and stuff. But yeah, in order to fully reverse it, you've got a lot of work, but restoring that leaky barrier leaky gut is going to be the first thing to have them feeling better.
Yeah. Well, I think a key takeaway here, maybe we can talk about this in the follow-up as well, follow-up webinar, is obviously pasteurized Akkermansia is not just beneficial for blood sugar regulation and weight management. There's numerous other benefits here. As you get into that very targeted, beneficial improvement of the colon health, especially, but also the small intestinal health, you are going to have downstream effects that relate to inflammation, to immune function, to endocrine function, and everything in between. So it's obviously very limited to say that this is only related to weight management and blood sugar regulation, right?
I agree.
Correct.
Yeah, and just because we're finally talking about Akkermansia, so many people have known about Akkermansia for years and years and years. I mean, you look back to that research, like Dr. Carullo said, dating back to 2005. It's just that finally we have a tool to directly support it. We've been indirectly supporting it with butyrate production and changing the lifestyle, and we've done before and after stool studies many times and seen zero Akkermansia. And then after doing all the gut healing and nutritional changes, repeating that stool study a year and a half down the road, and poof, it just appears, right? You put salmon on the ground in Alaska, a bear's going to show up. So what are the different tools that you as your practitioner and patient are going to come up with to make that bear show up in the wilderness?
Yeah. Key takeaway is that, the intent of this formula is not to replenish, like Dr. Oubre said, Akkermansia levels. We're not trying to manipulate and replenish Akkermansia levels. The mechanism here is a postbiotic, and as you said, Dr. Keller, it's downstream systemic benefits interacting with the immune system and improving barrier function integrity. And then everything is just a domino effect from there.
Yeah. Okay, last question, because a number of questions have come in.
This is another one of those last 4 questions
No, I'm
wrapped in one.
This one's short, but there have been a number, so we're covering a lot of questions here. You touched on this, you went through it fairly quickly, but what would you say is the best way to know, other than symptom management, that there is a positive effect happening? What kind of testing would you use? Would you go to organic acid testing, to GI effects or GI map, or what is kind of your ideal path here to ensuring that there's a positive outcome taking place?
So I was just asked this by a new patient just yesterday, and I think it's old school, it's old fashioned, but I think we've lost the art of ask the patient, just ask them, but in order to ask them, you have to have asked them the first time. You have to have listened to their story and asked about their sleep and asked about their energy and asked about their pain and asked about all the different brain fog aspects and everything, so that when you see that patient again, instead of ordering another $300 stool study where they got to go sift around in their crap, like that's disgusting. Instead of paying $400 to go do an organic acid test and freeze their urine and all that, just ask the patient, are you better? Is this working? Are you worse? And that's another important part. If someone hasn't mucked around in the gut long enough, die-off, you need to look that up, Herxheimer reactions, if you haven't heard of it. Die-off makes the patient worse, but they always feel better afterwards. So ask the patient. I do not like repeating. Patients already have to pay a ton of money on supplements and physician visits and all that. Don't make them do another test when you can ask them a question. Use your words, listen to them. Maybe that's old school, but
no, I agree. And if you do have testing available, like just take a step back and like look at the totality of the tests, right? I think a lot of practitioners like look on the nitty gritty at individual tests and what do they mean, but what is the whole picture telling us, right? Because we know, Metagenics and Functional Medicine Institute and PLMI we did a study showing that there's gonna be loss of function before disease ensues, right? So if we can see changes on labs, positively or negatively, we kind of should know what direction that's going, right? 2 or 3 labs might mean blood sugar. You can look at gut, liver. So yeah, just take a step back and look at the whole picture going on.
Sorry, Amy, before you jump in, I'm just going to press them one more time, because I don't disagree asking the patient 100%. I'm old school like that as well, because 9 times out of 10 you get the answer. But if it's not blood testing and you had to pick one specialty test, what would you use to evaluate and provide data that things are actually changing?
Organic acid for me.
I will also agree, not because it's that much better than stool study, but I think our science in the stool study world is so lacking, and it's so easy to cover up dysfunction in the stool study world because our labs just aren't good enough. Organic acid testing gives a little bit more sensitivity, a little bit more stuff. In addition, it gives you a smattering, just like Dr. Carullo said. If your organic acid testing looks at gut health, it looks at detox, it looks at neurotransmitters, it looks at protein, it looks at so many other things. So organic acid testing, and we specifically use the NutriEval version of organic acid testing because you get glutathione levels and other markers.
Right? We need to learn, not learn, but a lot of the metabolites that are being tested are for research purposes only right now. So if we can, get those into like mainstream tests, then maybe it might creep up as one of our second. But yeah, for now, I think it's organic.
Plus, patients will dig in their poop once. Good luck trying to the second time. Good luck.
Fair enough. Well, our timekeeper is here, so Dr. Oubre, Dr. Carullo, thank you very much. This has been fun.
Thanks for having us.
You're very welcome. This was a ton of fun.
Yeah, we look forward to doing it again. Amy?
Yeah.
Excellent. Thank you so much, everyone who attended today. And thank you so much to Philip, Malisa, and Alex for this great presentation. Everyone look out for an email with a link to view this recording and a special offer from Metagenics. Anyone who has any additional questions can send them to me at amy.regan@fullscript.com. I hope everyone enjoyed this presentation and have a great rest of your day. Thank you so much, everyone.
Thanks. Take care.